When first responders get a call for a baby not breathing, obviously that ramps everybody up. But our role as first responders, first and foremost, is to take care of the baby. That's our patient. If there's any possibility to resuscitate the baby, that's our priority. But if we realize, or if you realize that that baby is no longer viable, then realize that your job is not done. Your job then immediately transitions to making sure that the caregivers or the parents are then taken care of, whether they need medical care or whether they need some sort of emotional support. We need to make sure to provide that. If they're really distraught, then we will try to give them emotional support. If they need medical care, also we will provide medical care for them, but they become our priority rather than the baby. We as firefighters and first responders, we really like black and white. We like a lot of rules as far as a checklist to follow. But when you respond on a call, there really is no checklist beyond the checklist of trying to resuscitate the baby. Then after that, there is no set way, because each parent, each caregiver is going to respond differently. Each culture is going to respond differently. So we have to really be aware of that. We have to really show quite a bit of empathy and be able to be flexible in the way we care for those folks. I think it's important for first responders to remember the word empathy. That is the biggest thing, is realize that the parents are suffering, and that they have just lost a loved one, a baby, and that is traumatic no matter how you cut it. You have a chance to make a big difference in the way that those parents or that caregiver recovers from this incident by being empathetic. These calls are tough. I mean, they're tough any way you do. I mean, anytime that first responders respond on a child that is not breathing, whether it be from SIDS or whether it be from some other sort of trauma, a drowning, those type of things, they're traumatic calls that you remember for the rest of your career. And this is not my words, but I've heard it say that each time we get a traumatic call like that, it's like having a backpack on, and we put those things in our backpack and we keep putting them in our backpack. And if we continue that way and keep putting stuff in our backpack and don't take time to take care of ourselves by taking some of those things out, then pretty soon that backpack is going to become too heavy and you can no longer function as a paramedic or a first responder. So to unload that backpack and to make sure that you're not suffering from that secondary trauma, it's really important to take care of yourself. And the way that I've done that through my career is immediately after the call is to discuss it with the rest of the crew. Make sure that, first of all, I always make sure that the rest of the crew is okay. I make sure that I'm okay. Also recognize when those discussions are no longer good enough, that you're still suffering from that secondary trauma, that you're going to need maybe the help of a professional, a clinician of some sort. There should be no shame in making sure that you seek help if you feel like you need to speak to someone, because I still remember calls from 20 years ago, vividly, more than 20 years ago. I remember names and I remember patients' faces, and those are things that you're going to carry with you the rest of your life, really. So it's important that you're able to make sure that your wellness is a top priority also.